Accountable care organizations were first formed several years ago when the healthcare legislation passed, and we wanted to find an idea of how we can take better care of seniors and spend less money doing it. And so Medicare created an instrument called Accountable Care that allows us to have more coordinated care, to have a little bit more transparent and well-communicated care of our patients. In a platform that actually raises their health status, that makes them healthier, that allows their doctors to talk to each other, and allows us to just follow the patient through the course of different care platforms. Physicians are going to like the experience under Accountable Care. Most physicians go into practice with the idea that they really want to take great care of patients, and Accountable Care is going to help them to do that. Physicians who are taking care of patients inside of the Accountable Care platform are going to find that the individual care plan really helps them. Once a year, we want patients to meet with their physician and spend time going over every aspect of their care. Every doctor who is involved with their care, every test center or facility that might be involved with their care, and we want that all in a plan that's an individual stapled packet that goes with the patient, that goes to their caregivers, and goes to every single doctor who's involved with their care. Our specialists will have a patient come into their office who they may not have seen in a while, and yet there's the individual care plan from the primary care physician right there, showing not only who all is involved in the care, but exactly what's going on. That allows the specialist to say, here's my role, here's what I'm supposed to be doing, and here's who I need to communicate the results to. And that makes everyone's life easier, and the patient gets better care. Unlike the 1990s, when physicians were in health maintenance organizations and other platforms where there were a lot of rules, a lot of limitations as to what kind of tests they might be able to order, or where they can admit a patient to the hospital, those sorts of things. Really, Accountable Care is going to achieve the savings and the increase in quality by having doctors talk to each other. The idea is that if reasonable, intelligent physicians and other caregivers who are involved in the patient's care talk to each other and are on the same page, that good decisions will be made, and it'll be the right decisions for the patient. And so rather than a rule-setting type of situation, it really is going to be about encouraging collaboration between caregivers, and that's going to lead to the good outcomes that we need. BJC's Accountable Care Organization is going to be a zero-risk program. There's no downside. There is no loss of income should the savings that we hope to achieve not be realized at the end of any given year. And so physicians and specialists can be involved in this, still receive their full fee-for-service rate that they normally get today, and have no risk that if this doesn't work out as everybody plans financially, that there'll be any risk to them at all. So it allows us to step into this new world and try to take better care of our patients, be more collaborative with each other, and not have any financial risk in doing so. And what BJC is doing is we provide a number of services to make this easy and to make it affordable. One is the provision of case managers who will follow patients through the continuum of their care, both at the office setting, into the hospital, into nursing homes if they need to be there, and back into the physician's office. And they can fill gaps in care, provide a valuable source of communication, and communicate important information back to the physician so the physician always knows what's going on. In the same way, we provide something called the Community Health Portal through our network information systems that allow different hospitals and doctors' offices to share information. For those folks who are going to be involved in our Accountable Care Organization, they get that as a free benefit from BJC, so that now they are linked in to all of our care systems. And so if something happens to their patient, they can literally see the reports the same day. They can see everything that's going on, and that's going to really increase their ability to be effective in that market. BJC has had an approach to building a network of physicians who take care of seniors in a way that I think is very positive and respects the individual and independent physicians' practices very well. There are a number of healthcare groups around the country and even in St. Louis who will build their networks based on employment. So an individual physician may be offered a chance to join, but that's only if they give up their independence and their ability to run their own practice and instead join a large health system. BJC respects the right of individual physicians to maintain their independent practices and wants to collaborate with them and enter into agreements which allow us all to take better care of people. but at the same time, maintain those kinds of independent relationships. And I really like the fact that that collaboration in the community is really going to be a strong point of our ACO.